All right, let's talk friend to friend. Have you ever wondered in the quiet moments if that very private part of your personal life is helping or hurting you? What if I told you that a simple, natural act could either be a silent risk to your health or one of your best-kept secrets for longevity? Today, we're going to pull back the curtain on this taboo topic once and for all, because understanding this could profoundly change your well-being. If this is a question you've ever asked yourself, do me a favor and hit that like button, subscribe for more honest health talks, and let me know in the comments where you're watching from so I can give you a shout-out next time. I get it. This isn't exactly the kind of thing you bring up over a cup of coffee. It can feel awkward, even a bit embarrassing, to discuss these intimate details, but here in this space, we're going to treat it with the respect and honesty it deserves. Think of this as a confidential chat, a safe place to explore a crucial aspect of your health without any judgment. Our goal here is to empower you with knowledge, because that knowledge is the first step toward a better quality of life and true independence in your golden years. You deserve to have all the facts plain and simple. So let's start by getting to know the main character in our story, the prostate. Imagine a small, walnut-sized factory located just below your bladder. It might be small, but its role in your overall health is absolutely gigantic. For many seniors, this little gland is a source of anxiety, but understanding its function is key to mastering your well-being. It's a fundamental part of your male anatomy, and giving it the attention it needs is a cornerstone of healthy aging, something we should all strive for. This little factory's primary job is to produce prostatic fluid, which is a vital ingredient in semen. Think of it as the support crew for the main event. This fluid is packed with nutrients and enzymes that protect and nourish sperm, ensuring everything works as it should. It's a beautifully designed system, a testament to how our bodies are built for continuation and vitality. Understanding this basic biology is the first step toward appreciating the more complex ways it impacts your long-term health and your journey toward longevity. Now, let's tackle a common concern head-on. What happens if this system isn't, shall we say, flushed out regularly? Some men worry about this, and for good reason. For those who suffer from a condition called chronic prostatitis, a persistent and often painful inflammation of the gland, regularity can make a world of difference. When things get stagnant, it can worsen the symptoms of congestion and discomfort, negatively impacting your quality of life. It's a classic case of use it or, well, feel the consequences. Picture a slow-moving river that starts to get clogged with debris. The water becomes stagnant, and things just don't flow properly. It's a similar principle with your prostate. When you don't ejaculate frequently, the ducts can become congested, which can exacerbate the inflammation associated with prostatitis. This isn't just a theory, it's a practical observation that has brought relief to many men. This simple, natural process is one of the body's built-in healthy habits for maintaining internal balance and well-being. So for men dealing with the nagging discomfort of chronic prostatitis, increasing the frequency of ejaculation can be a game-changer. It acts like a natural cleanse, clearing out those internal pathways and reducing the pressure and inflammation that cause pain. It's a simple, drug-free way to manage symptoms and improve your day-to-day comfort. This is a perfect example of how listening to your body and embracing its natural functions can be a powerful tool for better health and happiness. But the benefits don't stop there. Here's a surprising perk that many people don't consider: a better night's sleep. Yes, you heard that right. The act of orgasm releases a wonderful cocktail of hormones in your brain, including prolactin and oxytocin. These are often called the feel-good hormones, and they have a powerful relaxing effect on the body and mind, making it easier to drift off into a deep restorative sleep, which is absolutely essential for healthy aging. Just think about it. How many seniors struggle with getting good quality sleep? It's one of the most common complaints that affects everything from your mood to your cognitive function. This natural release of hormones acts like your body's own internal sleeping aid, gently guiding you into slumber without any side effects. This contributes directly to a better quality of life, giving you more energy and a sharper, more active mind to enjoy your days to the fullest. True well-being is often found in these simple, interconnected cycles. This connection between sexual activity and sleep is a powerful testament to how integrated our bodies are. A good night's sleep promotes mental clarity, emotional balance, and physical rejuvenation. It's a cornerstone of longevity and a key ingredient for genuine happiness. By embracing this natural rhythm, you're not just seeking pleasure. You're actively participating in one of the most fundamental healthy habits for your overall health. If you're finding this information valuable and eye-opening, do me a small favor and tap that like button to let me know. You see, all these little pieces, sleep, mood, physical health, are deeply interconnected. They are the essential building blocks of true, sustainable well-being and the foundation of healthy aging. To help you put all these pieces of the puzzle together into a cohesive plan, I've poured my knowledge into a comprehensive guide called Wellness and Aging: Valuable Tips for Seniors. It explores nutrition, exercise, and mental happiness in much greater depth, giving you a roadmap for a vibrant life. You can find the link for it in the first pinned comment right below this video. Now let's move on to the main event, the question that I know is on everyone's mind. Can this private activity actually have an impact on your risk for prostate cancer? For decades, this has been a topic of speculation, but now science is providing some astonishingly clear answers. This isn't just about feeling good. It's about a potential strategy for protecting your health and enhancing your longevity in a very real and measurable way. The findings might just surprise you. The most significant piece of research on this topic came from one of the most respected institutions in the world, Harvard University. This wasn't a small, insignificant study. Researchers followed nearly 32,000 men for an incredible 18 years, tracking their habits and their health outcomes. When you have a study of this magnitude, the scientific community pays close attention, and the results have had a profound impact on how we view prostate health for seniors. And what did they find? The results were nothing short of remarkable. The study concluded that men who reported ejaculating 21 or more times per month had up to a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times per month. Let that sink in. A 33% reduction in risk is a massive deal in the world of preventative health. This suggests a powerful link between this natural habit and your long-term well-being. So, the million-dollar question is why? What is the secret mechanism behind this protective effect? Well, the scientific community has several fascinating theories, and it's likely a combination of factors working together. It's not magic, it's biology. Understanding these potential reasons can empower you to see this not just as a random act, but as a proactive step in your journey toward healthy aging and greater personal independence. The first and most intuitive theory is called the washout hypothesis. Think of your prostate's tiny ducts like a kitchen sponge or a complex network of pipes. Over time, potentially harmful substances, including carcinogens from the environment, can accumulate in the prostatic fluid. This hypothesis suggests that each ejaculation acts as a cleansing flush, clearing out these toxins before they have a chance to do any damage to the cells. It's a simple yet powerful concept of internal housekeeping. This washout idea makes a lot of sense from a practical standpoint. If you don't flush the system regularly, those potentially harmful substances have more time to sit and interact with the sensitive tissue of your prostate, potentially increasing the risk of cellular mutations that can lead to cancer. This highlights the importance of proactive health measures. It's not just about avoiding bad things, it's also about actively promoting good, cleansing processes within the body for better long-term health. Another compelling theory revolves around hormonal balance. Frequent ejaculation may help maintain a healthier equilibrium of hormones like testosterone and other androgens within the prostate itself. These hormones are powerful growth signals, and keeping them in check is crucial for preventing the kind of uncontrolled cellular growth that characterizes cancer. This is a key aspect of maintaining your body's natural state of balance, which is fundamental to longevity. This hormonal regulation is a critical component of cellular health. When the signals are balanced, cells divide and grow in an orderly, controlled fashion. When they're out of whack, it can lead to chaos. So, by engaging in this regular activity, you might be helping your body maintain that crucial control, which is a powerful built-in defense mechanism. It's another one of those healthy habits that contributes to your overall well-being. If this is all starting to paint a clearer picture for you, I'd love to hear your thoughts in the comments below. A third theory, which I find particularly interesting, is that sexual activity acts in a way similar to physical exercise. It stimulates your immune system. Your immune system is your body's personal army, constantly on patrol, not just for viruses and bacteria, but also for abnormal and potentially cancerous cells. An active and alert immune system is far more effective at identifying and eliminating these threats before they can become a serious problem, contributing significantly to your overall health. Think of it as giving your internal defense team a regular workout. A stimulated immune system is a more robust one, better equipped to handle the challenges that come with aging. This connection between a healthy sex life and a strong immune response is a fantastic example of how our choices can directly influence our body's ability to protect itself. This is what promoting a high quality of life is all about, finding the habits that keep all your systems running optimally. So, it's likely not just one of these things, but a beautiful synergy of all of them working together. The washout effect clears out toxins, the hormonal balance prevents runaway growth, and the immune boost actively polices for rogue cells. Together, they create a powerful, multifaceted defense system. This holistic view is so important for understanding health, as it's rarely just one single factor, but rather a combination of healthy habits that create true well-being. This brings us back to a crucial point from the Harvard study. It didn't matter how the ejaculation was achieved. The protective effect was linked to the physical act itself, not whether it was through intercourse or masturbation. This is incredibly empowering because it puts the control squarely in your hands. It affirms your personal autonomy and independence when it comes to managing your health, which is a message all seniors need to hear. This knowledge reinforces that your health choices are personal. It removes any judgment or stigma and focuses purely on the biological benefit. It's about understanding your body and making choices that support its natural functions. This kind of information is vital for healthy aging because it allows you to build a lifestyle that is not only good for you but also feels right for you, honoring your personal needs and circumstances. Now, I can almost hear the question forming in your mind. Okay, Dr. Henry says 21 is the number, so do I have to hit that target? This is, without a doubt, the most important clarification we need to make. I want to be crystal clear on this point, because your mental health and happiness are just as important as your physical health. The last thing we want is to turn a natural, enjoyable act into a source of stress or anxiety. According to health experts like Dr. Henry, that number, 21, is an observation from a study, not a medical prescription. It's a fascinating piece of data, but it is not a goal you should feel pressured to achieve. The moment you start forcing yourself to hit a specific number, you introduce anxiety into the equation, and stress is notoriously bad for your health. It completely defeats the purpose of pursuing a lifestyle of well-being. The ideal frequency for you is completely 100% personal. It depends on a multitude of factors: your age, your overall health, your energy levels, whether you have a partner, your stress levels, your mood. The list is endless. True health isn't a competition or a numbers game. It's about finding a rhythm that works for you, that feels natural, and contributes to your happiness and quality of life, not detracts from it. The key takeaway from the science isn't about a magic number. It's about a broader concept, that a regular, active sexual life appears to be a component of a healthy lifestyle that protects the prostate. The most important thing you can do is listen to your own body. Find your own rhythm without any pressure or guilt. That is the path to genuine, sustainable health and independence. This concept fits perfectly into the larger puzzle of healthy living. Think of it as just one of many healthy habits, standing alongside good nutrition, consistent exercise, and maintaining an active mind. No single habit is a cure-all, but when you combine them, you create a powerful synergy that promotes longevity and an excellent quality of life. If you're with me on this balanced approach, give this video a quick share with a friend who might benefit from it. Now let's shift gears to another critical topic that worries many seniors. What happens to my ability to ejaculate if I need prostate surgery? This is a major concern, and it's essential to differentiate between the two main types of surgery because their outcomes are radically different. Having this knowledge beforehand is crucial for managing expectations and maintaining your well-being through the process. First, let's talk about the most common procedure: surgery for an enlarged prostate, technically known as benign prostatic hyperplasia or BPH. As men age, the prostate naturally grows and can squeeze the urethra, making urination difficult. The surgery aims to clear that pipe by removing the inner tissue causing the blockage. The crucial part here is that the outer capsule of the prostate is left intact. The most frequent consequence of this BPH surgery is something called retrograde ejaculation. This sounds technical, but it's a simple concept. It means that during orgasm, the semen, instead of being expelled outward, travels backward into the bladder. This happens because a tiny internal gatekeeper that normally closes off the path to the bladder is altered during the procedure. It's essentially a minor plumbing reroute inside your body. It is incredibly important to understand this. You will still experience the sensation of orgasm. The pleasure should be the same, and your ability to have an erection doesn't have to be affected. The only difference is that you won't see any fluid come out. The semen mixes harmlessly with your urine and is passed later. Dr. Henry always makes it a point to explain this thoroughly before surgery to prevent any shock or frustration afterward. It's all about informed well-being. The second scenario is very different. This is the surgery for prostate cancer, known as a radical prostatectomy. Here the goal is curative, which means the entire prostate gland is removed, along with the nearby seminal vesicles. Because these are the factories that produce the components of semen, their removal means that semen production stops entirely. This is a necessary step to ensure the cancer is gone and to promote long-term longevity. Therefore, after a radical prostatectomy, there is no ejaculation of fluid. You can still experience the sensation of orgasm, which is often referred to as a dry orgasm, but there will be no fluid expelled. This is a significant change, and it's one of two major risks of this surgery, the other being potential impacts on urinary control and erectile function. It's a trade-off that is made in the name of saving a life and ensuring healthy aging moving forward. After everything we've discussed today, I want to leave you with one clear, powerful, and unshakable idea. When it comes to preventing prostate cancer, there is no single magic formula. There's no miracle diet, no secret supplement, and no magic number of ejaculations. The most powerful tool you have in your arsenal is, and always will be, prevention through regular medical checkups and a commitment to your overall health. This means embracing the core tenets of healthy aging that science has proven time and time again. Don't smoke. Maintain a healthy weight that feels good for your body. Fill your plate with a colorful variety of vegetables and cut back on heavily processed foods. And most importantly, move your body. A sedentary lifestyle is one of the greatest enemies of your prostate health and your general well-being. These are the non-negotiable healthy habits. The single most important action you can take for your longevity is to partner with your doctor. As Dr. Henry would say, making your annual checkups with a urologist, getting your PSA levels tested, and having a digital rectal exam when recommended is what truly saves lives. It's all about early detection. Catching a problem early gives you the best possible chance for a positive outcome and preserves your independence and quality of life for years to come. Thank you so much for joining me today and for trusting me with this important conversation. My hope is that this has cleared up some doubts and empowered you with the knowledge to take control of your health. Now I want to ask you a question to reflect on. Beyond the physical, what does true well-being in your senior years mean to you? I would be genuinely honored to read your perspectives in the comments below. If you found this video helpful, the best way to support this channel is to give it a thumbs up, share it with a friend or family member who might benefit, and of course, subscribe and hit that notification bell so you don't miss our future videos. Your support allows me to continue creating honest, science-based health content for everyone. Now go ahead and check out our next video right here on the screen, which dives deep into the best exercises for maintaining mobility and happiness. Take care and be well.